Our next presenter, again, going to be online, is from Dr. Freddy Kitutu, who's a senior lecturer. You can hear him. Maybe we just put on mute. There, sorry, yeah. So it's Dr. Freddy Kitutu. He's a senior lecturer of health systems, pharmacy and research at Microbial University, and he's from the Antimicrobial Stewardship Program by the partnership that involves Microbial University Health Services in Uganda and Buckinghamshire Nhs Trust in the UK. In Uganda, he teaches courses of infectious diseases, pharmacy, research methods, and pharmaceutical policy to undergraduate and postgraduate pharmacy and public health students. He has previously served as the Dean of the School of Health Sciences at Microbial University, and is part of a multidisciplinary group of researchers and scientists who conduct inquiry at a global level into how to create and co-formulate sustainable pharmaceutical systems in low middle income countries. Since the inception of the Commonwealth Partnership for Antimicrobial Stewardship by the Commonwealth Pharmacists Association and the Health Education Trust, he's been a volunteer clinical pharmacist in 4 health partnerships in Uganda and remains active in 2 of them. So that's some CV, Freddy. So looking forward to hearing your presentation. I'd like to welcome you here, and I'm over to you. So thank you.
Thank you very much. I hope you hear me.
Very good, yeah.
Excellent. Thank you very much for the kind introductions, and I will move straight to my presentation, which will basically highlight the work between the Health Education Trust, which I refer to as ESTHER, and the Commonwealth Pharmacy Association, who came together to implement the Commonwealth Partnership for Antimicrobial Stewardship in several countries in Africa. I'll focus on 2 health partnerships in Uganda. Next slide, please. So for those of us who may not know, Uganda is located in East Africa. Next slide. And it is a landlocked country surrounded by Kenya on the east, Tanzania on the south, and South Sudan on the north, and the big DRC on the west. Next slide, please. In terms of context, our population has one of the highest growth rates, currently estimated at 42 million, a total fertility rate of about 5 children per woman, as indicated by the previous speaker. Maternal mortality ratio is still high, and that's why we need a lot of the partnerships are focusing on reducing deaths among women and children. Child mortality rate is also still high at 43 per 1,000 live births. And then for antimicrobial stewardship, I think it's important to understand how health is funded if we are going to focus our efforts where we think work should be done. And for Uganda, our government funds about 15% of the health expenditure, and that largely goes to human resources and infrastructure. We receive a lot of support from health development partners at about 41%, and these include Irish aid and UK aid as well. And then there is out-of-pocket expenditure of about 40% again. This is money from household income that is directed towards life-saving health services. Insurance is very minimal at about 5%, and that access is still very low. Next slide, please. So as everybody knows, antimicrobial resistance is one of the biggest threats threatening humanity among the top 10, and following guidance at global level, and so countries were advised to set up antimicrobial resistance national action plans, which are basically policy level documents that highlight and emphasize priorities that countries need to implement, usually in a One Health fashion, so focusing on human health, animal health, and environment, so that they can reduce the drivers of antimicrobial resistance. I'll focus on antimicrobial use, which is one of the proven drivers of antimicrobial resistance, given that increased use of antimicrobials typically drives antimicrobial resistance. And here what we see on the slide is the Antimicrobial Resistance National Action Plan, and then the picture of the Honorable Minister on the day when it was launched in 2018. So until now, we're guided by this document, and a lot of the activities are focused on were supported at policy level by priorities in this document. Next slide, please. As far as governance is concerned, again, from that document, we have the One Health platform that focuses on basically all health conditions that are related to both human, animal, and environment. And those include zoonoses, diseases that can spread from animals to humans. They include pandemics like Ebola and COVID-19 fits in those as well. Below the One Health platform is the National Antimicrobial Resistance Subcommittee, which is again guided by the 5 core objectives that reflect what is in the WHO Global Action Plan on Antimicrobial Resistance. And we see that there is a priority to ensure that there's public awareness, training, and education. There's a priority on improving infection prevention and control. There's a priority on antimicrobial stewardship, optimal access and use, where a lot of our work is embedded. There's a priority on surveillance of resistant bugs, and then a priority for research and infection. As part of this, to ensure that information is generated and shared at regional and national level, the country has appointed focal persons who ensure that antimicrobial resistance data is shared with the WHO Global AMR surveillance system, and then also antimicrobial consumption data, and I'm the focal person for that currently in the country. Next slide, please. Again, emanating from the National Action Plan, guidelines have been developed to focus on surveillance of antimicrobials, particularly antibiotics in animal health and human health, and a lot of activities that were implemented with support from FET and CW PAMs were basically guided by the national guidelines for antimicrobial consumption. But again, the other point I need to state is that the development of these documents was partly also an offshoot of the emphasis by the FET and CW PAMs to build a capacity within the country for us to be able to implement some of the priorities in the AMR National Action Plan. Next slide, please. Yes, as one of the outputs of the CW PAM's work, particularly with me as a focal person, was to ensure that in the new National Pharmaceutical Sector Strategic Plan, which usually runs for 5 years from 2020 to 2025, there was clear emphasis on actions and activities that are aimed at strengthening antimicrobial stewardship at all levels, including national level, focusing on Ministry of Health and Ministry of Agriculture, but also at subnational level within districts and at health facilities and the community as well. Again, this very much borrowed from the emphasis and support from FET and CW PAMs, but then also provide guidance for ongoing work as still supported by the collaboration between the UK institutions and Ugandan institutions. On the left of the slide is again an important document, the Medicine Therapeutics Committee, which again formed the platform within which the CW PAMs and institutions in Uganda were able to implement activities on antimicrobial stewardship in a way that was coordinated and in a way that was building on what the Ministry of Health had already prioritized. Next slide, please. This is basically an extract from the strategic plan, which focuses on the strategy on strengthening antimicrobial stewardship at all levels. And you see that a lot of what CW PAMs emphasized was well captured in this document, and it remains an aspiration of the country, and again within our health partnerships between the UK and Ugandan institutions, which I'll be talking about briefly in more detail, trying to emphasize, particularly at the health facilities. So focusing on, for instance, objective number 7, action number 7, which looks at developing, disseminating, and implementing relevant provisions of antimicrobial stewardship national action plan, including operational guidelines and policies. And then also number 8, developing and disseminating the reporting platform for monitoring implementation of antimicrobial stewardship interventions at health facilities, where we basically need to do surveillance and be able to use the information being collected from the facilities to guide the next priority actions. Next slide, please. Next slide, please. Yes, so the CW PAMS, as I mentioned, is a partnership, and one of the things is to build on expertise in the UK hospitals, partnering with the institutions, hospitals in Uganda, Uganda being one of the low-income countries that is part of this global program. So as far as Uganda is concerned, in the first round, which started in 2019, 5 hospitals in Uganda partnered with 5 NHS hospitals in the UK to build capacity of antimicrobial stewardship, and has already provided the policy platform that provided areas of input where the medicines therapeutic committee manual. So what we did is identified hospitals where there were no medicine therapeutic committees, which are referred to as MTCs, and we supported them building on and borrowing from expertise from the UK pharmacists and pharmacy teams in the institutions that were participating. Next slide, please. Next, so what we did is ensure that the MTC has a role in AMS and IPC. We basically worked with the hospitals to support the nomination and identification of people who would make up such a committee, which had to be multidisciplinary, including pharmacy, medical doctors, nurses, an administrator, a biostatistician. And this committee basically sits together to prioritize and pick out, for instance, data that needs to be collected to inform their decisions in terms of promoting appropriate medicine use, or even identifying whether they are having enough medicines to treat the common infections that the patients present with, or whether the lab has an adequate supplies to be able to support the clinical decision making. And then also focus on infection prevention and control, which are referred to as IPC. As we know, it's probably the most effective way to reduce the development of resistance and spread of those resistant organisms, either from patient to patient, from health worker to patient, and vice versa. So the MTC was supported to start and implement activities that directly influenced the antimicrobial stewardship capacity at the hospital, and then infection prevention and control. Next slide, please. So let's have next. Yes, and the whole point, thank you very much. The whole point basically provides a framework within which we worked. Basically, together with partners from the UK, we did a needs assessment that focused on health workers' knowledge, skills, and capacity, and then also the health facility capacity. We also used globally known tools known as the Point Prevalence Survey, which basically looks at how antibiotics are being used, whether it's appropriate or not, whether it's according to the treatment guidelines or not. And using that information, we prioritized what the MTC needed focus on. And again, the interventions, again, here referred to as a customs intervention, focused on, for instance, creating awareness among the people, setting up processes, for instance, standard treatment guidelines for certain conditions that were not being managed properly, but also for best practices such as hand washing at particular moments, commonly referred to as the 5 moments of hand hygiene, and then the structure. So setting up the MTC, helping them to be able to prioritize activities and communicate those activities so that they are able to be implemented at the ward level, and then also to ensure that they are seeking the necessary support from management in terms of individuals being appointed, but also in extra resources that were required. And some of this was done through workshops and support supervision, including visits where we partnered with volunteers, NHS volunteers, pharmacists, and and behavioral scientists together with us in Uganda, visiting the hospital to support this. Next slide, please. So this is a summary of what we did. Next slide, please. And I'll go through quickly some of the outputs. So with support through the CW PAMs, we're able to do a national level consumption audit where we looked at central medical warehouses and identified which antimicrobials were basically available in the country and where they were being distributed, again, as a way of understanding what antimicrobials are being used and how that influences the development and spread of antimicrobials. This work was published in a paper, and if you can see the cursor, that's what I'm referring to. But we're also able to do through the same health partnership support to do point prevalence surveys using a protocol that is typically used in the global north developed by Antwerp. And we did this in Uganda, but also in countries that were participating, including Ghana, Zambia, and Tanzania. And we're able to basically provide one of the earliest evidence about antimicrobials and stewardship interventions and how the CW PAMs had changed the landscape in these hospitals. Similarly, we did another point prevalence survey in 13 hospitals 1 year later and also reported. And generally, one of the findings out of this was that a lot of antimicrobials were being used for prophylaxis for surgical procedures, which is typically well understood. However, the challenge was that the prophylaxis was going on for longer than is recommended. So typically, 1 day to ensure that any microbes that could have infected a surgical wound are cleared. But in these hospitals, we saw a prophylaxis going on for 3 days, 5 days, which from our assessment was not indicated. And of course, the results were shared with the hospitals, and discussions of it to intervene were also considered. Next slide, please. So these are some of the pictures, and here we see health workers from Jinja Hospital who were beneficiaries of the training that we co-developed with health workers from the University College London Hospitals and London School of Hygiene and Tropical Medicine, who were the UK partners in this health partnership. And after the training, they were invited to join the antimicrobial guardian movement, where they pledged certain actions that will demonstrate that they would give them opportunity to illustrate the knowledge and skills acquired from the training, and then also the ongoing movement of trying to be stewards of antimicrobial, the current effective antimicrobials, so that they can last longer. The picture on the right of the slide is basically one of the training sessions using PowerPoints and facilitator, but of course very much interactive to capture the adult learning principles. Next slide, please. Again, additional outputs. On the left, we have a session where we're joined by one of the members, the Commissioner of Pharmacy from the Ministry of Health. And the importance of this is that these activities were not only focused at the health facility, but they were much linked with the national level policymakers and decision makers. And here, the Commissioner was addressing the health workers about the priorities of the department, but also the importance of addressing antimicrobial resistance from the point of antimicrobial stewardship. On the right, we have, again, the enthusiastic healthcare workers after their training displaying their certificates of attendance and so on and so forth. Next slide, please. And this again at Jinja Hospital, where we're joined by our partners, volunteer NHS health workers. In the center is Preet Penasa, who is a lead microbiology pharmacist at the University College London Hospitals. And then we're also joined by the behavioral scientist, Dr. Corina Ware, who at the time was based at the Manchester Change Exchange group that focused on behavior change for microbial stewardship. And we see Professor Claire from the London School as well as somewhere in the middle where the cursor is. And on the right is again another session where we had partners joining us, and this was national level stakeholder meeting of the national level antimicrobial stewardship task force, where again findings and learnings from the health partnerships at the hospitals were shared, and those with policy implications were discussed, and directions were given. Particularly here, the discussion was about laboratory support for clinical decision making. And one of the leading medical microbiologists was making her point right at the back on the importance of strengthening this, and why it can only, it is only after labs are functioning well that we shall be able to do proper microbial stewardship. Next slide, please. Again, this is a session where we're preparing to go and do point prevalence survey. On the right, this is again the partnership supporting the Secretariat of the MTC with basically equipment, a laptop, and a printer, so that they're able to run the MTC activities, communicate, print standard treatment guidelines, and then also share any results from the audits, the infection prevention and control audits and consumption audits with the physicians and all the healthcare workers who need to take action. Next slide, please. Yes, and then we move to the second partnership, which saw a team from the Buckinghamshire NHS Trust in Buckinghamshire with the Microbial University Health Services. And what we see on the left of the slide is the team that basically put the health partnership together and worked using the health partnership principles of FET to build capacity for microbial stewardship at the Microbial University Health Services. And again, a story of this partnership has been published on the FET website, and this link hopefully can be shared for those who want to learn more. But basically the same model using expertise from the UK, working with multidisciplinary team members in Uganda. We set up an MTC at the hospital and then build capacity of the health workers for microbial stewardship interventions, and then also IPC. And probably one of the standout was using an antimicrobial stewardship game that was developed by the CW PAMS to basically find a creative and interesting way of passing on some of the knowledge and skills of antimicrobial stewardship. And we applied this game, and the health workers found it very, very helpful and enjoyable, but also informative and educative on some of the important concepts of antimicrobial stewardship in health facilities. Next slide, please.
And you might keep going through the next couple of slides quickly because we're just a little short of time. So if we've got the next couple.
Thank you. I think I have two more. Next slide. Yeah, so this is again a slide showing us when the Ugandan pharmacists visited the BHT for bi-directional learning. And what we have here is basically the biweekly quality improvement hurdle. Next slide, please. Yeah, these again pictures showing us the interactions between the Ugandan pharmacists and BHT pharmacists. Next slide. The same thing, this is visiting the microbiology lab at BHT and going through how audits are done at BHT. Next slide, please. So the summary of it is that through this arrangement, we've been able to increase awareness among healthcare workers about AMR as an existential threat, but also the NHS volunteers have benefited immensely in terms of their leadership skills, project management, being able to work across cultures and contexts, and their understanding of challenges of low and middle income health systems. And then health facilities in Uganda have set up MTCs that can continue implementing this in a way that is sustainable. And then there's also better understanding of the status of microbial stewardship and IPC. And generally, the partnership is a good model for bi-directional learning and knowledge exchange. And with that, I thank our next slide, all the partners who have supported who appear on this next slide, which basically there is the UK government and the Fleming Fund and the NHS institutions, but also the Ministry of Health in Uganda, Makerere University, and the hospitals that have been very supportive. And in a way, a bridge has been built between NHS through the FET and CW PAMS partnerships. Thank you very much.
Thank you very much, Freddy. That was great.